Good morning, Ben.
Good morning, Shaw.
Yeah, I'll be your host today. Unfortunately, my other host is due to some not feeling well, so I will be your only host this morning.
Yeah, no worries.
Okay. Good. So you know all the just want to quickly is I'm going to go through the slides, and by the time I get to your slide,
Mhm.
I will pass it to you, and I will say the mic is yours, Ben. So then you'll
Okay.
take over, okay? And we will pass you the control. Then you can switch the slides either with the arrow button on your keyboard, or just put your mouse over the screen and just click.
Yeah, no worries. Yeah, I'm actually all right with Zoom. I have used it before, so.
Perfect. How is your French, Ben?
Oh, I don't speak French, Shaw. Sorry.
Okay, that's not a problem. So that's fine. So I have already asked all the attendees to trying to put their questions in English. Okay.
Okay, that's really helpful.
Yeah. Yeah. So thank you all, ladies and gentlemen, mesdames et messieurs, mon ami, mes amis, our friends. Bonjour, bon après-midi, bonsoir, à tous. Good morning, good afternoon, good evening, wherever you are. We are going to start a bit early today because I can see that there's a lot of people. So I'm anticipating a lot of questions. And once again, I would like to remind all the listeners is please try to write your English that's related to Ben's presentation today, as well as trying to do it in English. Use some rough translation or put it in English as much as you can. Okay, so that we can so our presenter can understand your questions. And I also noticed that people are asking if this presentation will be done in French. No, this presentation will be done, today's webinar will be done in English. If it's in French, then our entire marketing, the advertising, even the listed in our website will be in French. Then that means the presentation will be in French. Okay. Encore une fois, notre webinaire aujourd'hui, c'est en français en anglais seulement. Okay. Thank you all for joining us. My name is Shaw Kwan. I am the VP of Global Outreach at G-TAC. And I'm also a senior employment counselor here at G-TAC as well. And it is my pleasure to welcome Ben to our presentation today. Today's topic is orientation on career path for nursing related occupations in Canada. And we are really honored and privileged to have Ben joining us today to do a presentation. Now, before I'm just going to run through quickly because I went through Ben's little bio there. He is quite a quite an accomplished young man. I mean, an RN, RPN, 2 diplomas and a certificate in Canada in different specialties, and he's also very what we call the very flexible individuals as well. I mean, talented and flexible individuals with background in nursing, financial accounting, payroll. He's an excellent communicator, a great instructor, great mentor, and he has trained many nursing students in the past as a nursing tutor. So, and I believe, Ben, you're originally from India, is that correct?
That's right, Sean. I'm from India.
Okay, good. Okay, wow. So, and definitely he can also share with you is kind of, the kind of transition that he made. He's obviously did a very successful transition from his home country to Canada and established a new career here. So I personally really look forward to this presentation myself as well. So before we get any further, just want to talk a little bit about G-TAC. For those of you that's listening for the first time, G-TAC stands for Global Talent Alliance Canada. Basically, we're here to help connecting newcomers with Canadian employers by providing you with the latest information regarding jobs, different fields, such as today's in terms of the personal support workers. We host Canada's largest online job fair. We have done this 11th time already, and our 12th one will take place on September 27 and 28, 2022. We partner with 400 employers across Canada from coast to coast, and we also partner with municipalities, regional authorities, and as well as provincial government. The fact that you're watching right now is a testament to our reach to all the newcomers or people that are thinking about coming to Canada. Is we have hosted over 600 live webinars through our digital platform since 2016, and we'll continue to bring more very relevant topics to you. You just check our website and you'll see all the latest, the upcoming webinars in the coming weeks and months as well. So the topics includes variety of Discover Canada, LMI, the labor market information, media employer, career coaching, etc. For those of you that has already enrolled, I think we started our new accounting training class on Monday, May the 16th. It is still not too late to join. If you're interested, please contact Song, song.g@g-tac.ca. This is for anyone, and all these trainings are completely online, so you can take it wherever you are. You might need to adjust your time because of the instructor's availability for these training classes. And same goes with the cybersecurity fundamental class, which we are just about to finish the current one, and we will be starting a new session soon. So if you're interested, I will type this email, Song's email, in the chat box later. And of course, today we are very excited to have Ben joining us today to talk about our new training class. It's called Occupation Skills Refresher for Personal Support Workers in Canada. And you will, and Ben will tell you everything about the course and the benefits and who qualify for this training. Okay, the class will start on June the 6th. Class will start on June the 6th. Okay, please contact Song Guo. That's song.g@g-tac.ca. Now I understand many of you are from French-speaking countries. That's fine. We understand that. If there's enough interest from the French audience, please let us know. We will have the survey. Let us know, and if there's enough interest, we will consider opening a French training class, in French. But right now, the entire training will be done in English. Okay. So without further ado, well, before I go introduce our guest today, is there are two upcoming webinars that are related to healthcare professionals, okay? One is on June the 6th. It's called Pathway Health Center for Children and Vacancies Available. And it's going to be presented by hold on, let me just close this here. Let's close sorry. Okay, it's going to be presented by Pathway Health Center for Children's Ontario. And on July the 14th, there will be a topic on employment opportunities for healthcare professionals, and is organized by Horizon Health Network in New Brunswick. So by all means, if you are interested in these healthcare professional webinars, please register for June the 6th, June the 9th, and July the 14th, okay? Let's go like this here. And as I mentioned earlier, is our 12th National Virtual Career Expo, the largest online talent attraction and job fair, is now open for registration. Please go to G-TAC-expo.com. It will take place on September 27th and 28th. So by all means, please go and register now. Okay, it's open to everyone, regardless if you're in Canada or around the world. It's open and registration is free. Okay, so without further ado, I would like to now ask our presenter, Benny, to take over. Ben, the mic is yours.
All right, thank you, Shaw. So, like when I was looking at the chat there, I saw that there was people joining from Algeria, Nigeria, Qatar, then Haiti, and Morocco and Cameroon. This is really nice to see a lot of people joining. And when I see you guys like posting the questions, I actually go back like 10 years when I was in your position, like planning to come to Canada. I was like really, I wanted to know a lot about Canada before coming here. And also I wanted to know what the job opportunities was. I was in the same position as you guys there. So that's why when I see you guys like post question, I even saw a person post that I'm really happy to be here at this time. This is actually really great. So I can see that intention. I can see that intensity is there with every one of you, so that you guys want to learn more about how Canada is and how helpful it is like to migrate here as a healthcare professional. So that is basically what I'm going to discuss here. I'm going to discuss more about personal support worker in Canada because that is something that most of the with the new programs and everything, you may not have to take a course depending on your province. So that is something that I'll be discussing later on. So in this presentation, mostly we are going to concentrate on what personal support worker is and where it falls in the healthcare, and how you can become a personal support worker, and how you can later on proceed like becoming a nurse, like becoming an RPN or an LPN and becoming an RN. So this is basically what I'm going to discuss with my slides. I'll just share my slides. Shaw, I think you will have to. Oh, okay, so that's good. Okay, so you already uploaded the slides, right? So that's good.
Okay. So now you can do the arrow backward to get back to the previous slide.
Yeah, no worries. I thought actually I was staring from my screen, so no worries, no worries. So basically, we just saw about what G-TAC is and how they're helping people like you guys come to Canada. So this is something that is great. So that is something that we saw, and we are going to see a small explanation of why to come to Canada. So this was initially my first question. Why should I choose Canada? So I know like you guys sitting there in your country, you're right now thinking about lots of countries. That's how I was. I was thinking about New Zealand. I was thinking about UK. I was thinking about Australia because my background in India was an RN. So basically, I was looking at all these countries. I'm not saying that all these countries are bad. I'm just saying why Canada is actually a little better than most countries. So that was kind of like my initial thought. Like I was deciding which country to go. So this is kind of like I'm giving you an idea of how Canada is. So you guys can decide which country to move. So that's why I thought I'll put in a little slide that says about the benefits of being here in Canada. So I'm not making it long because that's not the hard topic today. So basically, Canada is well known for its mosaic culture. So there is people like in the attendees who have a family. So they want to know how, like when you come here, is your culture accepted, or how is Canada culturally? So it's very diverse. So like you see a mosaic here, you can see it on the left side of your screen. So this is basically a mosaic. So what a mosaic means is there are different cultures. So different colors, if you take for example, is considered as different cultures. They all coexist with each other. And that's what makes Canada like really good and a better place for a culturally diverse person. So being here in Canada, you're looking at something like this. So I'll give you an example just to understand that much better. United States of America is considered as a melting pot. So a melting pot basically means like a lot of cultures, they just go in, they melt and something else comes out, or a different culture comes out. So basically there you have a merging of culture. I'm not saying that USA is bad. I'm just implying that like Canada, when you see, what happens is when you see a mosaic, like when you go to a church and when you look at glasses with different colors, when they reflect the rays of sun, they actually shine in different colors. So that's how culture is. So when they shine with different colors, it's really beautiful. And that's the beauty of Canada. And also Canada is ranked #1 for the best quality of life. Daily Hive, a trusted portal, ranked Canada as second safest country in the world. So Canadian job market is welcoming the immigrants with open arm. And Canadians enjoy universal healthcare. So the healthcare is free. I can go on and on and on, but I'm not doing that because that's not the topic. So I just wanted to give you guys some of the things that are really good in Canada compared to other countries. So next we'll see healthcare profession. This is a topic that you guys are here for. So we will see like a couple of divisions, how they are arranged. So a nurse practitioner is the highest priority person here in healthcare in Canada. So a nurse practitioner, I guess in your country too, you may have somebody uh, who, like your basic setup of healthcare is also going to be similar to what Canada is. So you can actually relate it. So a nurse practitioner is a person with a master's degree and an advanced diploma in nursing. So basically, he's kind of like a doctor, but he is not allowed to prescribe certain drugs, but he's actually kind of like a doctor. So he's kind of like a doctor who can prescribe like a lot of drugs, but there is some restrictions from his part that he doesn't become a complete doctor, but still he is given the status of a doctor. That's what a nurse practitioner is. And next you have an RN. This you guys may already know, it's a registered nurse and it's usually a 4 years bachelor's degree in nursing. And next you have an RPN. So RPN is registered practical nurse. In some province it's called RPN, some province it's called LPN. So you will have to just go through with the province to see which province it's called LPN and which it's called RPN. And they both basically means the same. And it's a 2 years diploma program. And then next you have PSW. This is the thing that I will be concentrating more because becoming a PSW in Canada is not really very hard. So you guys could move to Canada as a PSW. And why I'm implying on that is because first up, like you can become an RN and an RPN that I'll be discussing later on in Canada, but there is lots of formalities, and whenever there is formalities involved, you guys know that there is going to be a time period involved. So roughly now it's actually longer. So it's usually going to take some time for you guys to get into the system and become an RN. So basically somewhere around, don't quote me for this, this depends on like how the paperwork is from your country. So I know in some countries it's really hard to get paperwork done so that you can give it to the organization here to know whether you're capable of being an RN or an RPN here. So depending on all that, it may take a minimum of 1 year or maximum of like 4 or 5 years, depending on how fast you do everything. So it's a really long process, and there is a lot of factors influencing that too. So on an average, it's kind of like that, the time period. So in that meantime, instead of working like in a place uh, like Starbucks or kind of like a food chain, you could work as a PSW. So this is kind of like an option that you guys have since you guys have a medical or a healthcare background in your country. So that is what I'll be discussing more, because the pathway to becoming a PSW is much simpler. And in the process, while you're a PSW, what happens is that you're introduced into the Canadian system. So what happens is basically you're not just like when I came to Canada, I have seen like a lot of my friends were RN. I was an RN, my wife was an RN. So I have seen the transition go for a lot of people. Some people, they did not want to become a PSW. So what they did was they waited till they became an RN. So the problem with that is you're introduced into the system quite fast. So being an RN, you have more responsibility. Being a PSW, the responsibility is not as much as an RN or an RPN. So basically, what happens is when you're a PSW first, so I was also a PSW. I worked as a PSW when I was here in Canada, when I was studying in Conestoga College for my diploma in nursing. So at that time, there is a lot of difference for people who become PSW first and people who become RN first. So people who become RN first on the first day of work, they are really overwhelmed because there is a lot of responsibility. So what happens is it's kind of like introducing a person directly into hot water. So there is lots of responsibilities. You don't understand the healthcare system like really well. So you have to take a lot of time coping up with the system. So that is kind of like a drawback of becoming an RN first. But when you become a PSW first, you're having an opportunity to watch an RPN and an RN work. So basically, you're introducing yourself slowly into the healthcare system. So first, you don't have much responsibility as a PSW. It doesn't mean that you don't have any responsibility. The responsibility is not as much as an RN. So basically, you can watch what an RN and an RPN does in a clinical scenario. So basically, you're going to be the third person. It's not bad to be a third person to watch someone else do the work, and then you will realize, okay, this is actually a very good nurse. So you start picking up the skills that they have, and slowly, by the time you become an RN, you already have picked up all the skills that you need to survive in the Canadian healthcare system. It's like, I'm not saying that it is very hard. I'm saying that it is different. So when you have, like, I know I have worked in healthcare in two different countries. It's entirely different. When I worked in India as an RN, the healthcare system there was really different. And the healthcare system here in Canada is really different. So this difference you have to understand. So with RN, there is lots of delegation. So you make people work, and you have to know what are their jobs and responsibilities. So you will have, being an RN, if you're working in a long-term care setting, you will have RPNs under you, you will have PSWs under you. So you will have to know what work they do first. so that you can actually give them work. That's called delegation. So you can actually let them know to do this work or to do that work depending on what their skill sets are. But if you don't really understand what their jobs are, you're basically doing their work. So you're running around as an RN, you're doing their work because you feel bad to ask somebody to work. So this is all the problem that I have seen with nurses who come from different country to Canada. So delegation of work is an important skill that you have to start like learn being in Canada. Is sometimes in your country it may be different. So being in Canada, you have to learn that skill. So how do you learn that skill? You get introduced into the healthcare system. Like, I'm not implying that you have to become PSW. I'm just saying that it's actually much better. You're introduced into the system slowly and you will understand the concept. The next thing is like speaking assertively. So speaking assertively is an important skill that you have to learn, especially when you're an RN. So assertive speaking is a healthcare skill here. I never learned that in my country. I can say that. So I can really understand that most of you guys may not even have heard the term assertive because I did not hear that. So basically assertive speaking means that politely replying to someone about a task or saying whatever you feel politely to another person. So if a person is being very rude to you in a clinical setting, just replying to that person politely, that is called assertive speaking. This is very important in healthcare in Canada, and also it is important in lots of other professions related to healthcare. I also deal with like I am a teacher like here in Canada. So I work for a career college. I teach healthcare classes and also I teach accounting and payroll. So I know that these two different fields, they have lots of things that are common. So in nursing and also healthcare setting, assertive speaking is one of the skills that you guys need to learn. So this is why we at like G-TAC, we are putting together a program, uh, like a refresher program to help people understand the healthcare system here in Canada. And that is what Sean was showing you guys about the program. So I'll be showing you guys about the program. So you guys can decide whether you guys need like want to take this program or not. So it's actually made in such a way that you guys would understand and you guys would understand the healthcare system here better. So you guys can be introduced into the system uh, without having any difficulty. So benefits of international nurses to become a PSW in Canada. So it is not necessary that you have to complete a PSW course uh, or you have to wait like the RPN or RN. So there is like many programs. It is called a grandfathering program and it is done by Ontario Personal Support Worker Association. So basically what you have to do is you have to go to their website and upload all your information and regarding your healthcare experience in your country. And then they will let you know whether you can practice here in Canada as a PSW or not. So the process is not really very long and it is much faster than becoming an RPN or an RN here. And next is like you may qualify for incentives and certain benefits. So basically depending upon the province you want to move. So that is another decision that you guys have to make. So that decision, like once you decide you're going to come to Canada, you have to decide a province. So that decision can be influenced by uh, how easy different immigration programs are in different provinces and depending on like newer programs that come about. So I'm not going to discuss about all the immigration things that because I'm not really qualified for that. But basically, that is how you would probably decide on which province to move to. So basically, depending on the province that you're moving and depending on the area of work, sometimes you can have incentives. for joining work in that particular place as a PSW. So right now, as you guys all know, like people know that when there is like demand for a particular profession, that's what healthcare has here in Canada. When there is a demand, there are lots of hospitals, there is lots of long-term care that are ready to offer incentive for people to come in because they're short of staff. The healthcare system now here in Canada, we are short a lot because when I came into Canada like 10 years ago, the system was different. Uh, I finished my diploma, I finished my RPN here in Conestoga College. I took the course again, and like I was an RN in India, but I ended up taking a diploma here in Canada as well. So I really know the transition. I really know what's the difference in education in Canada and also India. So what I have seen is when I passed out from my course of being an RPN in 2014, there was not much opportunity for a nurse in like big cities. Big cities had enough staff. Small cities were still offering jobs. So I actually moved to a small town here. And right now, the demand has really gone up. So in big cities, there is lots of need for PSW. So Ontario government, that's the province I am from. Ontario government here is offering a free PSW program for uh, people here so that people are introduced into the system healthcare. So there is lots of need for staff. So that's why there is lots of incentive. There is like free programs to become an RPN, and that is where you guys come in. So people who move from like Canada is dependent uh, mainly on the immigrants. So if you have like if Canada has lots of healthcare workers from different country move into Canada, the staffing shortage is going to be less. I'm not saying that it's going to go away because there is lots of demand. So basically, what I imply to say is that there is lots of incentives, lots of benefits that many hospitals are ready to offer when they have not enough staff in the community. And also they are really willing to uh, like have people from different country with healthcare experience work here in Canada as a PSW. So this is something that is very good. So you don't have to really wait long for like when you wait for your RPN or your RN, you can directly become a PSW here in Canada. The only thing that you have to know is you have to know different provinces have different rules. So you have to understand that. I know that in some countries it's not like that. Like for us in India, different provinces doesn't have different rules. Everything is kind of like similar. But here in Canada, the rules are really different. If you want to become a nurse here in Ontario, the rules are different. If you want to become a nurse in Manitoba, the rules are different. So you have to understand that concept too here, because everywhere the rules are different. And if you want to work in Ontario, you need to be registered under the College of Nurses of Ontario. And if it's a Manitoba, you have to be registered under the licensing board in Manitoba. So I'm not going to discuss a lot about that because that is a huge topic because each province is different, and the the need like what they prefer you do with documentation and everything is different too. So whenever you work as a PSW, the only thing that your employer, like most of the time, these are the main things that your employer will ask you to do. So you should have an immunization record. So this is kind of like an information so that you guys know that you guys have to get like immunized from your country just before coming here, because the cost of like I had this problem when I was a student. I didn't know this fact that I had to be immunized in certain diseases before I come to Canada, or I had to get immunization before I start my course as an RPN. Because when I did my diploma program as an RPN, I was posted in a clinical healthcare setting. So I had to do like a tuberculosis skin test, And there was a lot of other immunization requirement that was there. So it's always better to get it done from your country if that is an option. Next is you should have like some references to your work. Then a criminal background check is needed depending on your employer, and a certification for first aid and CPR. So these are not really like lengthy processes to get all these. This is not as bad as some other programs. So this are basically what they would ask you. So this is just a heads up for you. If you are offered a job here in Canada as a PSW, these are the things that most of the employers would ask. Next, transferable skills. What skills can you bring from your country traveling to Canada? Like being a healthcare provider there is like skills like effective listening, documentation, clinical. So documentation is like different from like some countries, I would say. But I'm speaking with on my experience there. I'm pretty sure now in India, like big hospitals, their documentation is pretty much online. Before, when I used to work there, it used to be paper most of the time. But here in Canada, most hospitals now have adapted to documentation with software. So these softwares, you just have to click for the care given, and you document everything in the system. So that is something that you could actually bring in from your country. So like documentation skills is kind of like same everywhere, the way you document healthcare information. Only the difference is the tools. So maybe in other countries, they may use paper. Here they use mostly computers, and it's not really hard to learn. Then clinical health knowledge, multitasking. This is something that we use everywhere. Problem solving, managing electronic medical records. So this is also a transferable skill that you can use. So this is a what like National Occupation Classification of PSW. So according to the government, government has classified PSWs into two different uh, sectors. So when you come to Canada, you will understand this is not really a division. There is lots of job like divisions, like PSWs who work in long-term care, PSWs who work in hospitals, PSWs who travel and work in home care. So there is lots of division, but the government as such, they recognize two of these divisions, and I'm giving it with the NOC classification because you can go online and you can search these classifications to get a much better idea. This is taken from Statistics Canada. This is a government, I've taken this from the government website. So basically, I just wanted to give you guys an idea. I will explain in detail what these two are and how they are different. So the first one that we will be discussing is 3413, nurses aid, borderlines, and patient service associate. So why I am showing you guys this is like, whenever you go to job bank is where you can see all the job postings here in Canada. So whenever you go there, if you see something like 3413, or if you see nursing aid, or if you see order line, and if you see patient service associate, you should understand they are similar to PSW. Should not think that that is a different job. So that's why I'm actually including this here. So these are the terms and terminologies given to PSW in this sector there. And the next one is 4412, home support workers, housekeepers, and related occupation. So they are also coming under the category of PSWs. So now we'll see basically where these people are employed. So people who are called nursing aides, they are usually employed in hospitals, nursing homes, and assisted care facilities. So they're going to be supporting the RN or an RPN with healthcare healthcare duties and other stuff. So I'll be discussing about the job responsibility of an RPN later on. And in our refresher course too, I have divided the roles and responsibilities of a PSW, RPN, and also an RN, so that you will understand. So the refresher program that I have devised, I've made it in such a way that it gives you guys all the information that you guys need to survive in Canadian healthcare system, so that you're not introduced into hot water directly. So next is like, so we'll see the next category. So that is 4412, home support worker, housekeepers, and related occupation. They usually work as home care, private households, and also support agencies. So these are the two categories that the government has divided for PSW. So we'll see uh, here we are seeing the job prospects. So this is something that you guys want to know, right? So this is a data that is being taken in February this year. So that's when Statistics Canada updated. So this is kind of a government website released information. So here you can see all the provinces, they have good requirements. So job prospect meaning how much they are in need of a personal support worker. So this is a personal support aid. So here you can see in Alberta, the prospect is very good. In British Columbia, it's very good. So you guys, whenever you guys are free, you can go to Statistics Canada. And that's why I have given you guys the NOC code. So you know which job to search. When you search, you will know the job prospect of each province. So now this is also actually going to help you guys decide which province to move into, because you know that the job is like job requirement there. Like there is lots of employer who are looking for PSWs. So in Ontario, it says undetermined, but I can guarantee you 98% that there is lots of requirement for personal support worker. This is still like, I guess they're probably still assessing or they don't have the data yet, but still I'm pretty sure this is like really, PSWs are really needed in healthcare system here in Ontario, because I am from Ontario. So that's why I gave you guys a heads up. Next, we'll see like home healthcare. So we will be discussing like what these two divisions are. So first I showed you guys the job prospect of a nursing aide. This is a job prospect of a home healthcare worker. So if you see, it's actually fairly good, most province. And this is something that you guys can decide when you guys want to move into a province. So this could be one of the factors that you guys decide, because you know that the job is actually there for you guys if when you guys reach that province. And this is something next, like I like when I was in India as a nurse, I wanted to know how much the RN or an RPN or a PSW gets paid here. So I know that you guys also want to know about the pay scale. So that's why I put this slide in. And this is also taken from Statistics Canada. So it's a governmental information. So government collects information and then puts it here. And the information is current. It is from this year, February. So you can see the wage difference in different provinces. But I wouldn't really suggest you guys take a look at this and decide the province, because the difference is each province sometimes have tax difference, sometimes has when you look at like purchasing certain items, some provinces are expensive, some provinces like housing is expensive, some provinces it's not, some provinces food is expensive, some provinces it's not. So when you see that you have a wage that is really high, you don't uh, you it doesn't necessarily mean that you will have in hand money as much as the other province. It doesn't mean, like some provinces the payment is really high, but when you spend money for grocery it may be higher, so that's why they're paying you more there. So I wouldn't ask you guys to base your decision of moving to a different province like in Canada based on just the wage, because that doesn't really work that way. You get paid more in some provinces because your expenses are more, or maybe you will pay more for housing. So that is something that you guys have to understand. But still, this gives you an idea of average how much a PSW makes. And instead of working like in McDonald's or Tim Hortons or other places as a healthcare worker, you could actually work as a PSW making more money. So that's why I thought I'll just put this in. So this is the information for wages for personal support aid. Next, we will see the wages for home care worker. So this is basically the difference. So each province, the wages are also different. So duties, personal support aids. So this is the duties and responsibilities of support aid. So support aid is a person who works in a hospital or a long-term care setting. So he or she assists with activities of daily living of the patient, takes vital signs, assists in collection of specimen for lab, transportation of patient by stretcher or wheelchair to surgery or treatment, maintain inventory of supply, maintain patient room and making beds, assist RPN with certain procedures as per policies and protocol of the institution. So this is basically the duties and responsibilities of a support aid in a hospital. Next, we'll see home care. So a home care is actually different in the way that you're actually providing care for the client at their home. So your duties and responsibilities are different from a healthcare aid. So basically, you will be delivering care and companionship for individuals and families through period of incapacitation. So when they have a hard time, you will be providing care for them, especially people who want to stay home and they have a disease that is actually very life-threatening and they decide to stay home. So you will be going to that individual's home and providing care and providing support so that they can actually stay at their home in the final moments of their life. So that is basically what this means. And assist in activities of daily living for a client at home, help client with meal preparations and assist with feeding, and perform routine duties as non-sterile dressings, assist with medication administration, perform routine household duties. So this will basically be all the duties and responsibilities of a home healthcare system, home healthcare worker. So this too, I'm going to be discussing in detail in the refresher program that I'll be taking. So career advancement opportunities. So this is something that everybody wants to know. Once I become a PSW, is it easy for me to become an RPN or an RN? Or what are the advantages of when I become a PSW? What are the advantages that I can take from becoming a PSW first before becoming an RN or an RPN? So like if you have healthcare experience in your country and when you move to Canada, when you work here as a PSW, so there is lots of advantages that you guys can have. So the advantages of working as a PSW in Canada is getting into the healthcare system in Canada, working as a PSW, understanding the healthcare system in Canada, helps prepare for licensing exams, will be able to refresh on medical terms and terminologies. So as I have given you experience, my experience, and I have seen a lot of my friends who have become like RN directly, and lots of people who have become PSW first and then become RN. I really could see the difference. So first thing, here in Canada, like let's say you are from another country, you came to Canada, you waited the 1 year period, and you applied you applied for all the documentation and processes to become an RN or an RPN here in Canada. And after 1 year or 1.5 years, you became an RN. Now the task for finding the job can be a little tougher because here in Canada, they don't really look at your experience from back home a lot. Don't quote me on that. It depends on how much the demand is also. So basically what the employer is looking for is they want to know your professional ethics. They want to know how good of a worker you are. So this is something very important that comes up like before your experience here in Canada. So being a PSW, how it helps is like PSW, there is lots of demand. So you will probably end up getting a job, like if you're in a city. So there is lots of factors influencing it. Don't quote me saying that it is going to be like this, or depending on the province you are, depending on whether you're in a city or a town or a small place, everywhere the situation is going to be different. But the advantage of being a PSW first is you're in a healthcare setting. So let's say you're working in a hospital, you become a PSW there. So the hospital employer knows you as a person. They know you have a good work ethics, and you have been working there for 1 year. Then you got your RN certification. Directly when you apply, you will be the first person they would prefer because they know you personally, and they wouldn't consider your experience in Canada at that point of time, and they would consider your PSW experience in that institution as kind of like your introduction into your healthcare. So that is a real advantage. So when you become a PSW in an institution and the institution knows that you're a good worker, and then later on you become an RPN or an RN, the chances of you getting a job in that institution is very high. They wouldn't look for a person. Most of the time, they wouldn't look for a person from outside. They would actually hire you for that job of an RN or an RPN. First thing, they don't have to train you a lot because you understand the system of that institution. So that is an advantage for an employer for hiring a person who has already been in that institution. So it's kind of like an upscale for your job. So it would be much easier for you to get a job once you are a PSW in that setting. Second thing is, it is going to be more comfortable for you because you have absorbed an RPN work, you have absorbed an RN work. So you have seen their duties and responsibilities. You have seen some good RNs, you have seen some good RPNs. So you basically start picking up skills from them, knowingly or unknowingly. And what happens is by the time you become an RN, you will start using that in your clinical setting. So you're not basically like coming into a healthcare system and not knowing what to do. You will already be knowing how the RN works, RPN works. So basically it's kind of like a slow introduction into your healthcare, into the healthcare system here in Canada. And also being a PSW, you learn a lot. You're in a clinical setting. So whatever you learn is going to be helpful for your licensing exam, becoming an RN or an RPN. So this is another advantage. So I'm not saying that becoming an RN here without becoming a PSW is bad. I'm just implying becoming a PSW first and then becoming an RN or an RPN is much better. Like you understand the system, and it's going to be much easier. Like rather than, for example, if you put your hand directly, like, or if you jump into hot water directly, you will feel the heat, right? So basically that is what will happen if you become an RN and you jump directly into the healthcare system. But if you introduce yourself slowly, you first put your legs, then you put your body, and then you slowly introduce yourself into a healthcare system, you won't feel that heat. So it's going to be much simpler, and it's going to be a much acceptable process. And also, you're actually going to learn a lot because healthcare system here in Canada is different from various countries. So this is basically what are the advantages of becoming a PSW first for an internationally educated nurse is. So I'll be giving you an introduction about my refresher course. So I would like to say like this refresher course is not a replacement for a PSW program. It is just a program made in such a way that healthcare nurses or like healthcare professionals like you guys get introduced into the system as a PSW. So you would, there are things that you need to understand becoming a PSW here. So this is kind of like an introduction. So as I mentioned with the example of hot water, we'll kind of be introducing you into the PSW system here in Canada slowly with this refresher course so that you're not going to feel the heat. So basically it contains 8 chapters, 90 minutes per class. I'm going to be taking the refresher program. and it's going to be a 9-day program. And the course outline is this. So you will learn a lot about healthcare setting, and you will understand what the duties and responsibilities are of a personal support worker, what the duties and responsibilities are of an RPN, what the duties and responsibilities are of an RN, what are delegating skills, what are assertive speaking skills that you need, and how you can introduce yourself into the healthcare system slowly. And that will all be discussed in this refresher program. So basically, this is to sum up. And I'm really happy that I was able to take a class, and I'm really thankful for G-TAC because from my personal experience, I would have liked to have a class like this before I came to Canada, because the only information I had was from online. But the problem is with online information is sometimes there are websites that put information in for their benefits. So it's not necessary that all the information that you guys get is correct. So always when you guys are referring to any information, refer it from government recognized websites. And how to recognize the government recognized website is like, it'll always be ending with gc.ca. So that is a government website. So there is lots of things that you guys can learn. Visiting government websites, the information are always correct. So this is something that I didn't know. So that's why I'm really happy I was able to give a class. I'm really thankful to G-TAC. I'll hand it over to Sean.
Thank you, Ben. Thank you very, very much. So wow. Okay, I just want to have pass the control to me, so I just go down to the next slide. Thank you, Ben, very, very much. Now, there's so many questions. Now, I have to apologize to all our listeners. Like I said at the beginning, we anticipated a large number of audiences for today's webinar. That's why we have assigned 2 people to help Ben today. However, due to medical reason, that person is not able to join us. So it's just me alone. And I asked everyone to try to put your question in English as well, just because I'm just overwhelmed. So I have to apologize to all our French listeners that if we cannot get to your question today, I'm so sorry, because it's just due to the limited resources. As you can appreciate, we're giving these webinar for free. So, and our resources are limited. So we wish we could give you, answer everyone's questions correctly today. But I have written down several questions that's quite relevant to your session today. Again, I want to remind everyone is please also follow G-TAC's LinkedIn profile, LinkedIn message page, Global Talent Alliance Canada. Follow our LinkedIn page, because we have the latest information on LinkedIn or on Meta or Facebook. Actually, I don't even know what should I call them. Is it Facebook or Meta? I don't know. Anyway, so please follow our LinkedIn page, because that will always give you the latest information. Okay, so of course you can also check our website. So Ben, here's a quick question. Very, very. This seems to be asked quite a bit, either in English or in French. Is there age limit to this training course?
No, and that is something that when I was in my country, we had age limit for studying. So we never used to see people who are past 60 in educational institution. Here in Canada, there is no distinction. So there is no age difference there. They can't really, they don't really bias you by age. That is actually illegal here in Canada. So there is no age problem here in Canada. They cannot really bias you by age. So if you want to work and you apply for a particular organization and they cannot tell that we are taking only a younger person, because that's a bias and it's illegal here. So I guess that probably answers your question.
Yeah, I just want to also emphasize is it's not just age discrimination that's illegal.
Oh yeah,
There's a
there is lots. Yeah, yeah.
gender discrimination, cultural discrimination,
Yeah, that's also a.
religious discrimination. These are all illegal here in Canada, right?
Thank you,
We
Sean.
believe
Yeah.
in equality, right? Yeah.
Yeah.
So okay, and there's a one of the listener viewers says I have no educational background in the healthcare. I'm mostly sales and marketing. I'm 44 years old. Is it too late to do a career transition?
The PSW program is not long. Like if at all you decide to come to Canada and you want to transition into a personal support worker program, it's not going to be hard. The program usually lasts half a year to 1 year, depending on how you're going to take it. So it could be like you could finish the program in 6 months and end up working as a PSW in 6 months. So as I said before, there is no age that is considered for you guys to study here in Canada. So if you don't have a background in healthcare, you can just
Mm-hmm.
come to Canada, do the 6 months or the 1 year program for PSW, and then work
Mm-hmm.
as a PSW immediately after that.
Okay. Now here's a good question, and this is from Martin. So it's a long question, so I'm going to read out the whole thing. And thank you, Martin, for this very thorough question. Hi, Ben. Please let me know a little bit opportunities for practitioner nurse with other advanced degrees, including doctor's degree earned from accredited countries outside of Canada. Look at your urge. I'm just reading the question, okay? So don't mind the grammar.
No,
Look
no,
at
no
your
problem.
urge background academically and professionally. I think you're the best person to provide more advice for those with advanced degrees in nursing areas. Please say something about besides opportunities than clinical jobs such as research, data management, or clinical research and trials, project management, etc. So please tell me more. I think if I could comprehend this question for Martin is what other opportunities are there besides PSW?
So basically, I will be speaking more healthcare. I saw that there was a lot of other professions too that Martin has mentioned. So I'll be professionally speaking about healthcare. So Martin had mentioned about a nurse practitioner there.
Yes.
So if you are basically an RN in a different country, you can't directly become an RN here. That I know most of them know. So there is lots of formalities and a lot of paperwork that you guys have to do. So you guys have to first register with an organization called NNES and then wait for all the paperworks to be delivered to them. And then slowly, once all the documentation and all the process is done, depending on your province, you would become an RN here. So after you become an RN, you have to work like almost a year or so
Mm-hmm.
before you apply for a course to become a nurse practitioner. So it is actually a straightforward process, but there it's going to actually take us around 3 to 4 years for you guys to become a nurse practitioner. So, but the sad part is, or like if you guys have a master's degree from back home in
Mm-hmm.
nursing, it's not directly recognized as a master's degree. You will have
Mm-hmm.
to first become an RN, then after a year experience of like after working for a year as an RN here in Canada, you can actually do the course. It depends like if it's a 1 year program or a 2 year program to become a nurse practitioner.
Okay.
And depending on each province, programs length can vary, and depending on university, the program's length can vary. So it is actually a little long process, but I'm not saying it's not possible. It's actually really quite possible because I have a couple of my friends who are nurse practitioners right now in Canada.
Okay. Good. Oh, ladies and gentlemen, mesdames et messieurs, we just open up our feedback form. So those of you that was asking us about whether we can have this course in French, please share that thought in the feedback. Okay, and let us know, because if there's enough interest, then we will consider opening up a training class in French. Okay. Okay. So here's a long question. Is there any physical requirement to become a PSW? Like that somebody needs to be physically fit? Like, is there a physical exam?
So it depends. Look, so here in Canada, as I said, each province has different rules. So likewise, each hospital has different rules. Some hospital may require you to take a physical examination before you work for them, but it depends on which like organization where you want to work. The first thing is when they put a job posting on, they would actually write down all the job requirement, all the duties that you're supposed to do. And if at all that any of the jobs and duties that is mentioned there, you're not able to do it, you will have to let them know. It depends on the employer to decide whether they want to hire you or not. So basically, whatever you need for a particular job, you can find in the job posting. So whenever, like, let's say, for example, if a hospital wants to hire a PSW, they're going to put a job posting. They're not going to just say that we need a PSW. They're going to give all the information on what all your duties and responsibilities are. And if you don't really or if your physical capacity doesn't allow you to do any of that jobs or responsibility, you have to let the employer know, and they are going to decide whether to hire you or not. And also, like physical examination, it depends on the employer whether they want to do it or no. It depends what their rules and what their rules are. So it's different from province to province and employer to employer.
Okay. I'm a bilingual nurse with 8 years of experience. I am looking to come to Canada. Would taking this training course help me?
Yeah, so basically, I'm not going to discuss anything about immigration. I'm just going to be discussing about uh, how to be like a healthcare provider here in Canada. What are the things to consider when you're coming to Canada, and how to introduce yourself slowly into the healthcare system. So taking this course, whether it'll help you or no, is something that you have to decide. So these are all the things that I'll be providing in this training there. So basically, if you feel that you need to learn more, about the healthcare system in Canada, yes, of course, it would help you doing this course. But if you feel okay, I'm all right, I can handle the system here, it's left up to you to decide. So you have to kind of like do a self-assessment on whether you require this course or no.
Yeah. Well, generally speaking, Ben, because I can see there's so many people that's from a healthcare industry right now, from outside of Canada, where we have some specialists, doctors, nurses. So generally speaking, if they want to come to Canada, just say, for example, I'm not going to talk about doctor because we all know if you want to practice as a medical doctor, it's extremely difficult. Yeah, it's extremely difficult. Literally, you have to go back to med school.
I know. I have like a couple of friends who were doctors, and one of them took almost 7 years, and he's very smart, mind you. He's very, very smart, and he took it's kind of like a minimum of 7 years, I would say, give or take.
Yeah, exactly. So yeah, and well, forget about that. I know somebody from Egypt.
Oh, okay.
It took her 5 years just to become a pharmacist here in Canada. She was a licensed pharmacist in Egypt, but it took her 5 years to finally get her license here as a pharmacist here in Canada. Yeah, it's so pharmacists. What about registered nurse? Do you know like it's through, like, for example, do they have to go through PSW first Would that be, I know you explained that earlier.
Yeah. So
Yeah.
for an RN there, you
Mm-hmm.
don't have to become a PSW first to become an RN. So, but you could become a PSW and work as a PSW, which is a higher paying job than a
Yeah.
regular job. So, so that 1 year period or the 2 year period where your papers are processing to become an RN,
Yeah.
instead of working like in like a food chain like McDonald's or Tim Hortons or other low paying like jobs, you could
Mm-hmm.
actually work as a PSW getting higher pay, and also you will be introduced into the system. So it's not really needed that you become a PSW here first, but there
Yeah.
are lots of advantages being a PSW here first,
Yeah.
and then becoming an RN.
True. Yeah. You literally. Yeah. You know what? This is so true, Ben, because as a career counselor, I can tell you over my thousands and thousands of clients experience, I always tell them sometimes you might have to take a couple of steps backward
That's
before
true.
forward, right?
No, it's
Right?
actually nice because
Yeah.
first of all, you're actually seeing someone else work and you're
Yeah.
learning a lot from somebody else's experience, right? So
Yeah.
that's something, being a third person and
Yeah.
watching somebody else work and getting their experience is actually much better than you being the person and learning it the hard way.
Yeah. So I also want to remind a lot of people, because I know a lot of people are looking for jobs here in Canada, is we do have a quite a good lineup of upcoming webinars where we will invite employers that are looking to hire people from overseas, okay? Skill worker from overseas. So please keep an eye on our LinkedIn page, or check our website. And I know we're way past the 10 o'clock. I tell you one thing, Ben, every Thursday morning from 9 to 10 is probably the fastest 60 minutes of the week, you know. it's always okay. In terms of taking these training courses, what language do you accept? Like, for example, what kind of English level would you expect to have minimum?
Like, um,
Let's use IO
yeah,
as
like
as a benchmark. Yeah.
yeah. So basically, like for the refresher program, right?
Yes.
So basically, if you guys have understood the class or the presentation I took today, it's going to be similar. I don't usually I like to make it simplified. I like to give examples, and that's how the class is going to be.
Okay.
So, like when I give you guys example, there is no real English level. If you understand the basics, you can actually understand from the examples. That's why I use a lot of examples. So there is no level, like, so entry level English is all good, because I'll be giving a lot of examples with this refresher course so that you understand the concept. I'm not going to only talk about the concept. I'm going to give you guys a lot of examples. So which is something that I have a lot because of my like past experience. So I'll be giving you guys that. So it doesn't really language. If you are understanding basic English, you will actually understand the program.
Yeah. You know, Ben, I have to tell you, this is my personal feeling, okay? And I want to share this with you. And this is not in any way trying to promote the course. But I'm looking at it. I'm thinking that I should join myself too, enroll myself in this course. And by the way, for those of you that's listening, even if I join, there's no discount. Okay, there's no discount. But I am thinking about joining myself, because you know what? It's never too old to learn new things. Okay, it's like right.
That's how it should be. Like there is no like age criteria. You can learn like lifelong. Learning is lifelong,
Yeah.
and it is actually fun.
Yeah, and not only that, it's also benefit me, right? Because it's also benefit because it improved my knowledge about the this field, right? It's very, very important. So for those of you that's actually we need, unfortunately we need to wrap up because we have to respect Ben's time. and we need to wrap this up right now. So for those of you that's interested, please by all means write to song.g@g-tac.ca and get more information regarding our upcoming occupation skills refresher for personal support worker in Canada with your instructor Ben, and it will start on June the 6th. All classes are done online through Zoom. And there, okay, I understand you're outside of Canada in different time zone, so you will need to prepare yourself if you want to register. Prepare yourself so you adjust your time zone. You know, I know 9 a.m. it's like 6:30 p.m. in India, isn't it? Right?
Yeah, it is.
Yeah.
And
right?
whenever the time changes, it actually goes 1 hour ahead and 1 hour behind.
But in your course there's no time zone changes, thank God.
Oh, okay, that's really good. It should be like that all across Canada. It's actually very confusing.
Yeah. We'll see. We'll see. This is something that neither you and I can do anything about it. But I really want to thank everyone for joining us. And now, Ben, I'm going to give you the honor to close today's webinar. Give you a closing statement in 60 seconds.
Yeah, I'm really thankful to see so many people join from like different parts of the world. I'm really excited to meet all of you guys. Like if at all you guys take the refresher program, because it's actually a good learning curve for me, and also it's going to be a fun experience.
Yeah, and very, very interactive as well, right?
Yeah, it's going to be very interactive. I'm going to learn a lot of things from you guys, and you're going to learn a lot of things from me.
Yeah. Okay. And like I said before, I don't be surprised if you see me in your class, Ben. Okay. Thank you all for joining us today in today's webinar. Really, really appreciate your attendance, and thank you for your understanding, because we just simply physically not able to get to every single question. So on that front, please accept my apology, my personal apology in advance for that. As you know, we're trying to offer this as a free webinar. So we want to try to benefit all of you as much as we can, but we also have to understand the resources that we are dealing with as well. So thank you very much for your patience, for your understanding, and we look forward to see you in our next webinar. Please check our LinkedIn page or our website or our Facebook page for the latest schedule of webinar, upcoming schedule webinar. Thank you again, Ben. On behalf of everyone at G-TAC and Ben, I would like to thank all of you for your time, and I look forward to see you next time. Merci à tous. Prochaine.
Thank you, Sean. Thank you. Thank you, G-TAC. Yeah. All right.
Bye.